Hey everyone, this is Courtney, Alyssa, and Alexis. We are finishing up Political Determinants of Health by Daniel Dawes. We have read chapters 6 and 7, and we're going to talk to you about them today and then finish up, since this is our last one, just kind of key takeaways that we felt, things that we have learned from this book, as well as things that we'll take away and kind of implement or think differently about as we move forward into our lives as people in public health. So yeah, Alexis, do you want to start us off?
Sure. So one of the things that he had mentioned at the top of chapter 6, when he opened up talking about the Affordable Care Act and just kind of going more in depth about it, he talks about it throughout the book. But in particular, one thing that really stood out to me was the fact that President Obama and his administration eventually passed this legislation and got it enacted. And there was so much confusion on who's going to benefit from it, what are going to be the detriments of it, who's going to be left out, and all those things in terms of like what was being communicated to the people, that eventually there was confusion as to whether the Affordable Care Act and Obamacare were two different things or the same thing. And the book pointed out the fact that during the campaign, people who had benefited from this health reform were still filled with contempt for President Obama and voted against legislation for this, and were very against his administration, even though, like I said, all these things had gone to their benefit and they were able to access health insurance and coverage and things like that. So that was something that I think was a theme throughout the book as well, and will be one of my great takeaways from reading this book. Just that the importance of health literacy and information, and making sure that us as public health practitioners and professionals are doing our due diligence to, be up to speed ourselves, and also have tools for communicating that to other people, and what they need to know and how it will affect them, and then ensuring that not only is that disseminated and accessible at like a local level, but that we're also doing that throughout the levels of local, state, federal government, and making sure that those things are prioritized. Because I think without that transparency and clarity and trust, I think that that's where a lot of those issues come into play, and why people don't really know what they're looking for or what they're benefiting from, and then how to vote or how to act on it.
Yeah.
Oh, sorry.
Nope, that's you.
Everything, it gets so entangled in terms of political party and kind of what, your conception of the Affordable Care Act or Obamacare, like what you kind of believe that they are. It can get kind of conflated with like what your actual interests are. And so I think, like you were saying, health literacy is so important. And even just thinking about like, as ambassadors for This Is Public Health, like we have to do the social media takeovers. And like one of the main things that we were taught when we were like kind of training to take over the social media was that you have to make sure that like the information is digestible for people who may not be as steeped in public health as we are. So it's kind of, you really have to take a step back and like kind of understand your audience. And I think that that's so important for if we're going to ever push forward any more public health lobbying or any kind of things like that.
Yeah, and I think just as like a consumer of information in this country, because things have gotten as divisive as they are, people turn to certain places for information, right? And it's usually on one side or the other. Sometimes people stay really neutral, but to actually even get exposed to what another side may be receiving in regards to information, like we're not, I don't think, I think it's easy for people to be misinformed, everyone, and I would really like to see some type of coming together in regard to the information that we're receiving so that everyone can be well informed. I mean, because there are sometimes bad intent behind certain campaigns. I mean, we see them, we see political ads, we see what people talk about each other. It's insane. I mean, it's terrible, and like, I think it's also recognizing where power is being involved in this entire system. So I think it's really about education and information. And it's hard. Like Alyssa and I were talking about this before, like it is hard for people to absorb information, especially if it's not, at a literacy level that works for someone, and just to be exposed to things that you haven't been exposed to before. So it's definitely a challenge, and I would really like to see some type of way for us to receive information in a way that isn't as biased, but also too, like, I think it's a matter of us going to different places and like being exposed to different points of view in regard to how we get our information. Because I think that way we can take as much information as possible, make a decision for ourselves. And hopefully it's a decision that won't take away, my healthcare. And I think that goes to not just healthcare, but all other policies that really impact our lives. So yeah, it was kind of heavy at the end. And I did a lot of reflection on that too. It was just, yeah.
Yeah, I think that's something that like I have to keep on reminding myself is that like the work is not over and it really won't be ever. Just like learning about like all of the trailblazers that have set like driven public health forward and like other, social issues. Just like remembering that like just because they did this like great like landmark thing doesn't mean that like we just get to like hang out. No. Especially in terms of like teaching people that, it's ongoing. I think in itself is a challenge too, is kind of, even though these things have happened, we still have to like keep on telling people that like we're not done.
Totally. And you saying this was a quote, I think it was in chapter 6, Dr. Gary Nelson, president of the Healthcare Georgia Foundation, said health equity broadly defined as both a process and an outcome, a journey and a destination. The voyage is disruptive, uncomfortable, threatens a system that despises major reforms, and the advocacy never truly ends, for the destination keeps shifting. I mean, it's completely in line with what you just said.
I literally couldn't even like sum that up any better. That quote is too perfect.
Yeah.
Yeah, I have to say, like, we keep talking about like literacy and like being able to understand and look for the answers. And I kept thinking about like when I was reading this book, I think I've been, as many people I think in our generation sort of are, like a little bit of averse to politics and getting political and doing all those things. And I'm definitely guilty of that. And I think it just more so stems from the overwhelming feeling of it and just not even knowing where to start, and if what information you're consuming is going to be accurate and based in evidence and fact. But that's just an excuse. And so like reading through this book has just been really helpful to at least like get a place to start and to just kind of motivate me to be like, okay, I need to just start finding ways that I can digest it. And if I can't, then I need to just start asking people, because plenty of people around me like have the answers, or at least can point me in the right direction to start doing that. But sitting back and, just letting things continue and perpetuate as they are is definitely not the answer. And like you said, Alyssa, the work is far from done, and our destination points will continue to change as things evolve, which is, I think, just a great thing. And I'm very motivated to be, part of that process, as opposed to like a bystander and just kind of like hanging out in the corner. So this book, I think, was a great kind of launching point for me, at least for that stuff.
And government is literally for the people. It literally is for the people. The reason they are in these positions is so that they can speak for their constituents. So I think too, like, if we don't get something, like, you can reach out to these people that are representing you, right? And like we think about, and we talked about this in an earlier video about like the ratio of constituents to politician, right? Whoever it is that's representing you. And it's a lot of people, and it might sound like that person is so far away, but like you have some say in this, like through voting, obviously, but like contact these people, talk to them, try to get in, like, they are supposed to be responding to you. They are supposed to be answering your calls, even if it's not them, it's a staffer, like something. So I think I just wanted to say that too, because like, yeah, it's on us to understand this information, but it's on them for us to understand what they're doing too. Like, I think it goes both ways as well. Anyway, I just wanted to say that.
I feel like elected officials, like what they do, obviously it's not supposed to be like this, but like it's just such a black box. Like once we vote, it's like all of a sudden they're just like in there doing things, and it really, you're right, like we really are supposed to be engaging them and finding out what things they're doing,
holding them accountable too to what they say. And I think some people are really good at it, but especially like people in our generation, like we don't really realize that level of engagement, like you said.
Mhm.
Yeah.
Yeah. Courtney, did you want to touch on the
Yes.
example in the
Yeah.
book?
So Dawes does a really good job at the end, kind of tying everything back. Like there's examples of actually how the political determinants are at play, and then there's also, and we started with the story about the trees and the farmer, and that was a really great story to, I think, to start us off. But he used a real life example of policies and the downstream effects that they have on a person and their family and their health and a lot of other outcomes. And I think it just tied up the book in a really nice bow and gave a really great example of how these things actually happen. So it was a story about a woman named Jessica, and there were so many things that happened in her life. But ultimately, she didn't get the care she needed when she was pregnant. She had a lot of trauma in her life. Her parents had mental illness that impacted them as well as her. And, at the end of this, she didn't get the care she needed for her son. And he had some like neurological cognitive deficits. And these were all things that may have turned out differently if policy was different.
They call them
And
missed opportunities in the book.
yeah, exactly. And so I think something that really resonated with me in reading this story is that I know people who would see this story and would say, well, they made this decision. This is their it's their social environment situation. They had a choice in this, right? And I feel like sometimes yes, sometimes sure. But there were so many policies that were directly listed. If these things changed, this could have turned out differently. And so, like, let me just read you a couple, because especially too at the beginning of this, we were like, what's an example, right? And we talked about the Affordable Care Act, but that was a big pill to swallow, and there's a lot of things that went into that too. But these are just like small, not small, but I guess more accessible things for you to think about rather than this massive thing like ACA. So policymakers decided to cut back on mental health services for the community. That was the first one. They refused to mandate coverage of OBGYN services, authorized poor reimbursement rates for Medicaid, causing a lack of access to care, restricted bus routes, kept the community from becoming greener by denying the issue of permits to establish community gardens and operate a farmer's market, zoned a part of their community for a dump site, changed the water source, which negatively impacted the built environment. I'm just going to keep going. Let me just keep going. Failed to raise the minimum wage to a livable wage, right? They didn't ban smoking from the convenience store that she worked in while she was pregnant, right? They didn't invest the resources necessary to ensure the education system would meet the needs of all of the students. They did not create or enforce laws that protected tenants living in unhealthy conditions, right? There were, was it cockroaches? I mean, there were things in her home. She's a renter, like someone should be helping her with this. Improving the infrastructure of communities, such as building and maintaining sidewalks and recreational facilities. I mean, these are things that happens at the local level, right? So these are things that are happening at your city council, people to make decisions of whether or not to build a sidewalk somewhere, to give a permit for someone to make a community garden so they can eat healthy food. Like, these are things that are so like real, tangible things that could happen that could really have made an effect. And if all these things happened correctly, it could have turned out differently for Jessica and her son. And so it really, it made me think a lot about this and how many Jessicas are out there, like millions of people. And you don't even realize it, right? Because policy is so distant from what's actually happening in our day to day. And so I don't know, I just thought he did a really great job of tying everything together and drawing straight line examples of this policy. If something changed here, something could have happened here, which could have changed here. And like really just understanding the downstream effect. Yeah, I think it just really like solidified a lot of the themes that were happening in the book, and goes to show that it's not just a social or environmental or interpersonal decisions, like things that are happening. These are things that are happening on a political scale. And it really, revs me up to get involved and to do something different. And I know, Alexis talked about her key takeaway. Like for me, every time I was reading this book, I would put it down and start like searching for these organizations that they mentioned. Like, what is it that the work that they're doing? How are they getting involved? How can I get involved? I can go and protest in the streets. I can do all that stuff, but how can I use my skill set as someone who's been trained in public health and epidemiology for 6 years at this point? Like, what can I do and use my skill set to make these types of things happen for people that need this support? Yeah, my key takeaway was like, get in there. Let's
Heard it here first.
Get to work. Yeah.
What about you, Alyssa?
I mean, going off of what Courtney's been saying for the whole last 2 months now, the importance of local government. I feel like obviously there's a reason why they do it, but like I feel like there's such a focus by like the media on what we take in, and even what we look up ourselves just on like federal level policy. And that's super important and it does affect us, but like there's so many things happening like at the micro level that, like in the case study that we were just talking about with Jessica, there's so many just like smaller things that we do have more of a chance to affect, And so just like like you said about getting involved and just like making sure you remember that there are more accessible, elected officials and those types of people on city council that you have a way higher likelihood of hearing back from. And so just like not being afraid to really like step in there and ask.
And I just thought of something else that I really want to talk about because Dawes did a really good job of kind of summing this up. It's not just Jessica. It's Jessica's parents. It's Jessica's kids. Like it is such a generational impact. Something that happened, 100 years ago is still impacting us today. And one of the examples was the phenomenon of biological weathering, right? So like all these negative effects that happen in someone's life, whether they're in the built environment, the food you eat, whatever, all of them accumulating together, it leads to accelerated aging of telomeres, which are the little guys at the end of our chromosomes. And that leads to poor health outcomes throughout the generations. And so it really, I think that also puts it into perspective. It's not just like me and my life and what happens while I'm here, but it's what happened to my parents and it's what's going to happen to my kids and their kids after that. So I think it makes it so much bigger than what we think it is. Yeah, these things are going to impact us, sure, but we need to think about the generations to come. And policy has implications on that. It's much more downstream. It goes forever. It goes for a really long time. And that's important. I think that perspective is also important. Yeah.
I think it's something that's,
Go ahead.
I think it's something that's like, correct me if I'm wrong, but it seems like that's like part of this culture is that like you have this idea that like, whatever, like rugged individualism and like the idea that like you are 100% responsible for your own destiny. I mean, like, sure, there are decisions that you make that like will affect you profoundly, but there are so many other factors that like, I just feel like people, I don't know if it's that people don't like to acknowledge that they're not fully responsible for themselves, or like if it's something else, or if somebody would just rather hand it off to like another person to be responsible for themselves. I'm not really sure what that's about, but like, I think that it continues to be a challenge to get people to kind of make decisions for the collective, and so I think that'll be definitely something that we'll have to try and make look better in the future.
Yeah, I was thinking about a couple things like moving forward, beyond this book and just how I'll kind of be taking some of these principles with me, but like, this idea that the role of government is to serve the people, but what that looks like can be really challenging in terms of, what's too paternalistic and determining what someone can or can't do or have access to. Like one time in our ethics class, we talked about, addressing obesity, and like maybe you put out a policy that bans sugary drinks, right? But then that also infringes on people's ability to have the choice to have something, and like, what's too far. And so I think like when I think about how we're going to create these policies and what that looks like moving forward, and just like coming up with solutions, I'm now starting to think like, okay, what does that role look like, in terms of like what's feasible, what's ethically okay, and then to your point, Courtney, too, like, what are the long-standing impacts that these decisions are going to have? So it might solve a problem right now, but I think part of that policy creation, part of that process needs to be mapping out like what are the potential consequences of this, both positive and negative, and just making sure that we're taking that into consideration, that way, that similar to like screening and diagnostic tools, like if you catch it early, like, okay, so if we find out that it actually is going down this negative consequence path that we did have the wherewithal to think about, maybe we can start pivoting earlier than 50, 60 years on, when we realize, oh, oops, that policy just, was a disservice to this group of people for so long now, that now we're again trying to play catch up. So it just gave me that thought of like, I think that we need to start thinking through not only just like, what's the solution for now and 5 years from now, but what are potential long-term consequences, and what can government's role, or public health professional roles, or anything like that, what is the right balance of making decisions on behalf of other people. I don't have the answer, but those are like the questions that are running through my mind now as we move forward.
And I want to keep going because you both have said stuff that I'm like, I want to touch on this. So like, Alexis, when you were talking about policies, like, are we creating policy, thinking about creating them, right? So like, okay, there are many others that are going to be created. And I think thinking long-term about what those implications look like, very important, 100%. It's also identifying policies that have marginalized people, disenfranchised people. They're making policies anti-racist, right? Like there are policies that are hurting people right now. So it's looking at those, also targeting those, and recognizing the impacts those have had, and then changing them. So I think it's and that makes the job so much more challenging, right? Because it's not just like what's to come, but it's also like what has happened. That's something that, like, when you were talking about that, I was like, I know that these things are there too, and that yeah, and that matters. And also too, like, Alyssa, you made me think about when you're talking about the collective, like, why don't we do a better job of actually thinking about everyone else? And it has a lot, I think it has a lot to do with just making assumptions about people based on like your experiences, right? So like, oh, I wouldn't have done that, right? Or I why wouldn't they just do this? And I think it's really hard putting yourself in other people's shoes that live lives that look different than yours, and whether that's because they're in another state, or in another type of community, or they look different from you, or they believe in things that are different from you. I mean, it is hard to make. It's hard to understand their perspective, but I think if we can do a better job of that, putting ourselves in other people's shoes and saying, maybe there's a reason this happened this way, rather than just making an assumption that they did it wrong. I think that also, that can change a mindset a little bit, and maybe it can make us a bit better at thinking about just people overall, rather than just looking at the individual.
Yeah. It made me think of, I'm going to stop after this because it's going to go too long, but it made me think of that quote that he included from MLK, Martin Luther King Jr. And just when he was talking about how, we might not be able to like change the heart of people to change the law, but changing law could also prevent, in his example, me from being lynched, is what he was talking about, and which is probably a good thing. It's kind of like, the tone he was saying, so like, yeah, sometimes we're not going to change the heart and minds of people before enacting laws and policies, but enacting those policies and laws can eventually change the heart and minds of people, because it's, encouraging and demanding more conversations to be had, and looking at those other perspectives, and seeing people from a different light than what we have accepted as the norm in our culture, whatever that looks like. And that's not just in America. I mean, that's a global thing. So yeah, I think you made some great points, Courtney and Alyssa.
All of y'all. Ditto.
Overall, 10 out of 10. Loved this book.
10 out of
Really would
10.
recommend it.
Yeah. Anything else y'all want to talk about before we wrap this up? Any like last minute thoughts, considerations, questions even?
I just hope everybody reads this book. I mean, got a lot of questions on the social media. Where can I find the book? Just search for the book title in Google and you will find a couple of great places to buy it from. Please read the book. I mean, it's so good.
Yeah. Did you want to say something else, Alexis?
Oh, no, I said I echo that.
Echo that. Yeah. So that's Political Determinants of Health. Thank you so much to all of you who have participated by asking questions and have listened to us. And if you're just now hearing about it, we have recorded all of our conversations about these chapters. Go back, listen to them. If you still have questions, like we're still here. So I mean, hit us in Goodreads, hit us up in the Instagram. I'd love to keep this conversation going, but also to a little shout out. We have another book club coming, I think starting in January. I don't know when the first meeting is, but January through February, we're going to be reading Evicted, I believe is the book title. And so I think a lot of what we've learned from this book will kind of trickle into the conversations that happen there.
That's what I was thinking too. I
What'd
feel
you
like
say?
there's going to be a lot of like connections made, which will
Yeah.
be good.
Yeah, totally. So again, thanks so much for hanging out with us. We've enjoyed it. I think like we've got to know each other a little bit better too throughout this process. And so I think we're going to be getting heart emoji from Alexis. I think this has started a really great friendship between us too. And I take that away with me as well. So yeah, thanks everyone so much. And we'll see you around. We'll see you at the next book club with, do we know who's doing it?
Ashley and I don't know who that is.
Ashley and another public health. This is public health ambassador. So keep an eye out for that. Yes. So thank you so much, guys, and we'll see you around.
Thank you.